couple of pictures in here, both are a bit dated, as you can tell. I don't quite look as fresh as I used to on that picture, but I was under pressure to find a headshot and that was the only one I had saved, so there we go. In terms of me, in terms of sort of just introduction to my role, currently wear 3 hats. And again, another AI illustration here. I asked AI to take a picture of me and put 3 hats on my head. I specifically said, do not change me, just put the hats on my head. It has straightened my teeth, it's taken a bit out of my chin, and it's freshened up my eyes. So even when you tell it to do the right thing, it still ends up making some adjustments that you wasn't expecting. Maybe that's user error, but anyway. I've got 3 roles at the moment. So the first role is I've been head of the Performance Research and Intelligence Service at Manchester City Council for the last 7 or so years, and I've worked at Manchester since 2009 in various different roles around sort of research, evidence, analytics as we work through. I've also just recently taken on the role of Director of Research for our Health Determinants Research Collaboration. You've probably not heard of these, but this is nationally funded research programs where there's 30 local authorities around the country that are trying to do more with research and actually replicate some of the things that maybe happen in the NHS when it comes to sort of clinical trials and those type of things, but using it in a social context. So I'm working on that 1 day a week officially, and there's a team coming together to work on that. But it's an interesting area for this debate as well. And as Stu said, I'm also the chair of LARIA, so took that on 6-8 months ago. We're thinking about what our offer is to our members there, and actually trying to think about how can organisations like LARIA help people in the room from local councils and equivalents to be able to sort of do the best that they can do in their jobs, not expect everybody to have all the answers, but actually provide frameworks for us to be able to talk to each other, collaborate, share knowledge, share experience. So what I wanted to talk really around, as Stu said, is sort of, why use data in the first place? What does it mean? What does it mean to us all? How to do some of that with some examples of the types of things that we've been doing in Manchester. And then a bit of sort of reflection around sort of, well, that's easy to say, how do we make some of that happen? And, partnerships like this and rooms like this are the spaces where we can sort of think through some of that. So a couple of statements on here that we've used internally with our senior leaders. We've had a number of sort of discussions within the council. We've got different leadership groups. We've got our sort of corporate management team, the directorate, strategic directors, the sort of 6-8 people that sit around the table and sort of meet weekly on council priorities. We've got an extended group, which is our sort of immediate reports to them, our sort of extended leadership group around sort of practical, sort of functional things. And then we've got a senior leadership group, which is the sort of top 200-ish sort of service leads and managers around the organisation. And we pose some of these questions to that group to say, actually, if we're going to do data, it's not just Paul's job in the centre to sort of think about data and think about its applications and its use. But it's all of our jobs to think about why we should be data-driven. And we came up with this statement really to say, why should we be data-driven? The things in there is that we should need good quality data and we need it to make informed decisions. Going back to the points earlier around sort of efficiency and effectiveness, if we're not making informed decisions, we run the risk of actually doing the wrong things at the wrong time, not being efficient, not being productive, not being impactful for our residents in the city. But the flip side, we also wanted to make really clear to those leaders, what happens if you don't do this? So it's easy for us to say why to do it, but we put a bit of pressure on them to say it leaves them vulnerable. If they don't understand what's going on, then actually they're vulnerable, their head's on the line if they make the wrong decisions and things go wrong. It's also very difficult for them to navigate challenges, and we've got a constantly changing sort of landscape and sort of way of working. And if we haven't got the data and the intelligence and the confidence within service leads across the organisation, then how do we respond to those challenges with either delayed or, again, we make the wrong choices within there? So we've been quite clear and strong with those senior leaders around these are the things that we expect from you in those roles within the organisation. And then this is a bit dated now, but I remember about 10 years ago doing some work with the Greater Manchester Combined Authority around sort of why did we want to build data infrastructure, data platforms, bring things together. And I forget the person's name, the person who invented Club Card came along, spoke to us about how that played out and how that worked. But within there, that was designed just to be a loyalty scheme. It was about identifying people who were customers and actually offering them incentives in a fairly blanket way of working through. But what they realised immediately was actually they'd created a data platform. This was about them collecting huge volumes of customer insight data that didn't previously exist. And I'm paraphrasing a bit. I'm sure they did know a bit of that, but actually that's what the statement was at the time. And it helped them think about personalised marketing. So again, that stuck with me in terms of sort of personalised response to our residents in the city. They're not customers in the same sense, but actually understanding the differences and the requirements that each of them might have of the council and related services is an important thing to work through. But what they also found was collecting the data isn't the only important bit. You can collect huge volumes of data, you can have it available, you can do some very simple stuff with it, but actually, will it have the impact? They could pull out things from their existing data around top 10 best-selling products, and it might help them understand sort of supply lines and how they manage day-to-day and the here and now. But it took them to bring in a data scientist. And again, when we were talking about this about 10 years ago, data scientists were the flavour of the day, the new big shiny thing. And actually it's become a little bit more embedded and a little bit more broader now. But it took a data scientist to tell Tesco Club Card that actually you're asking the wrong questions. Actually asking questions around what has happened behind us and what's happened in the past is not where you add the value. And they suggested a simple change to say, stop looking at your top 10 best-selling products and start to look at the top 10 best-selling products that are not stocked in all stores. Then use your Club Card data to look at whether your customer base is primed to drive those sales. Would they want those products? And if they do, get those products out to those stores. That's business change. That's driven by data. That's thinking differently and not just about the here and now and the past of how do we sort of sell more in the things that we already know about, but actually how do we change our business model and deliver things differently. And I think this has sort of just stuck with me in terms of sort of the roles that I've been in around how do we sort of add that value rather than just do performance management or dashboarding or reporting. So sort of three areas as I touched on before, I wanted to cover what's data, what's intelligence, some of the stuff that we've been doing in Manchester, and then some of the things that I believe we need to do to make this happen. And, shout out as we go. There is some time at the end for questions, but if there's anything that you're not quite sure of or want to ask me, just let me know. So just in terms of data, again, this audience may be fairly clear and understand this, but two broad sort of types of data, keeping it simple: the quantitative stuff, the numbers, the data, the things in spreadsheets, the things in tables, the things you can count, and the qualitative stuff, the stories, the descriptions, the sort of customer feedback, those type of things that were in there. And both of those bits are important. So we're not just talking about huge data tables, we're also talking about how do we collect those stories and those contextual things that sit behind it. And in local government, as in most organisations, huge amounts of data that we utilise. The stuff over on this side is the more sort of transactional stuff. So these might be a bit small, but sort of finance, customer contact type data, caseload data, information from our partners and our commission services, all of the things that are very quantitative and actually about delivery. As we move into the middle, we've got the more qualitative stuff starting to creep in, but still generally sort of numbers countable, survey data, social media data, activities that and voice that's out there. We then have access to lots of national data through Office of National Statistics and other organisations. We've got regional data through the Combined Authority, as I mentioned earlier, but also through Northwest Groups in Manchester's case. We've got data that we buy, so market research data that we buy from companies like CACI and other places. To be able to bring that in and help us understand what's going on in our city, so we don't have to create all the data. We can actually identify what we need and then bring that in. And then just at the bottom, sorry, keep moving away from the mic. Just at the bottom, we've also got this thing that we include about expert judgment, because we don't want to sort of exclude the fact that there are some people who are the experts in this. Some of them are the people working in the council who do it day in, day out and actually know what's going on. The data might not say it, but actually they can demonstrate it and articulate it. Or it might be academics, it might be others, it might be other services, other sectors who are the experts within it. And then intelligence-wise, sort of we describe intelligence as sort of turning that data into something meaningful, driving some insight from it. So not just reporting on the numbers, but actually explaining why that number's important and what you might take from that, turning it into actionable insight so that somebody could take that away and actually use it and make a difference. And again, you'll get a flavour. I like these things that I see pop up on sort of LinkedIn and places, but again, I quite like the idea of data sort of processes are a bit like Lego. And, you know, I'm not sure if we've got Lego people in the room. We probably have. I think everyone's a secret Lego person. But I think that this is quite a nice illustration, and I've used this with some of my team to talk about the different components of what's involved in their role. At this end, we've got sort of data collection. We can collect all of the data under the sun, but actually if we just throw it into a pot and actually do nothing with it, well, what's the point? What's the value? It doesn't mean anything. We can't make any sense of it. So I've got, you know, people in my team who do data preparation, you know, sorting it into the colours, sorting it into the buckets that actually makes a bit more sense of how do you start to think about the data that you've got and how you might utilise that to answer questions. You then try and sort of visualise that, so not just the colours, but actually the colours and the pieces and the shapes and the sizes, and actually trying to add an extra dimension to it. Once you've got that, you can start to put things together into blocks, so you can identify what makes up the roof, what makes up the walls, what makes up the garden in this context. But the big important bit's the data storytelling. Actually, if you started at the end, if you started here and said, build me something, most people wouldn't build a house because actually they wouldn't have been through all of the stages. And it's important for us to think about how do we then describe that what this represents is actually a house within there. And just some other work that we did, again, a few years ago via the GMCA was with Nesta. But it sort of brings all that together. What it talks about is this sort of cycle of, you know, sort of where to use data and intelligence. Don't just jump in and do something because you can. Actually think carefully about where you want to invest your time and your thinking and your capacity. And basically they said, you know, start with a specific problem. Think about the problem that you're trying to solve, not just the possibility of creating something new. Define how, if you develop that, you will do something different. What will you do? How will you respond? Then you can work out what your data product or products might be. And then you can turn it into, do I actually have the data, the infrastructure, the things to make that happen? And it helps you think through the prioritization of the work that we may or may not want to do in this space. So I think for me, they're the sort of areas of why I think data and intelligence is important and why it's certainly important to local government in Manchester in my case. The next few bits are just a few examples of types of things that we produce in Manchester. So this isn't all about AI. Actually, very little of this is AI, if any of it. But these are the types of products that answer that question of being impactful, being meaningful, and making a difference. So I'll just run through these quite quickly, but we can come back if anybody's interested in any parts of it. So the first one looks like a fairly simple piece of work. we do a lot of work around adult social care performance, so trying to understand whether we are delivering what we need to the resident base that need our support, and actually have we got the right processes in place to do that in an effective, affordable, sustainable way, and working it through. But for years we produced these wobbly lines without the dots that went into our management teams, and there was panic every time the line jumped up or jumped down beyond the mean, and it was like we swing from one extreme to the other and sort of respond in the moment. What we did is we introduced some of the statistical modelling to look at actually when a point jumps from one side of the line to the other, actually does it make a difference? And most of the time it's just natural fluctuation that we shouldn't really be that worried about, because we should just get on with the job. And actually these blue bits are significantly below the average, and the orange bits are significantly above. Fairly simple modelling, fairly simple statistical tests that are off the shelf, but applying it to this had a massive change, because actually the discussions in the room then became much more around forget about the wobble and think about actually we've now got a significant problem at this point that we can test and work through. Similarly, we do quite a bit of work around sort of the local economy. That's not all about council data, and has required us to sort of bring in data around context in the national and regional sense. If we see lines jump or numbers spike in tables or charts, that's probably because of some of these national influences and macro influences, and we've started to put that into our products around the context and the way that we work through. There's nothing too clever about this. This is just really dashboarding. This is bringing data together, reporting it out through Power BI in our case, and actually just getting it into the hands of people who make decisions, both within the council but with our partners as well. The third example, again, people in the room will be more than familiar, but the spatial element to our data. This doesn't look like the most exciting example. I was just saying to someone before, my role is very varied. We've gone from adult social care to economics to now fly tipping and waste. I get involved in all of that. Well, I say me, my team is getting involved in all of this. But we produce a chart over here that talks about fly tipping incidents. You see it spike, you see it jump up, but actually sometimes that gets lost as an average across the city because it's in different places. And applying the spatial bit to say actually it's concentrated in a few areas means we can do something about it. So there's no point in saying that we've got, whatever that number is, 328 sort of incidents at the top of the thing. If they're 328 different places, actually, if they're all in one location, we can do something about that. So there's an ability there to bring together sort of data and place and put those two bits together. We now started to get into some of the modelling bits of the work that we do. This is some work we did with our sort of Directorate of Public Health. And looking at vaccine take-up, very similar to the fly tipping example in many ways, that actually if we were going to respond to low vaccine take-up, have we got the capacity and resources to do that everywhere? No, we haven't. So using data to look at where low take-up exists and where high vulnerability within the community exists in terms of these these conditions, these things, we can then draw out places to prioritise. And what we've got within the quadrant B at the top end are a handful of places where there is low take-up of immunisation but very high prevalence of transmission. They're the areas that we need to get into quickly and work effectively and differently on. It's not to say we ignore the rest, because we don't, but there's a universal aspect and there's a targeted aspect that we're using data to help us work through. Next level from that's two variables. We're now trying to do some sort of multi sort of variable analytics, and within here this related to our supported families programme, so our early help for families that needed additional support. This is all the assessment data that we get, and a very simple sort of tabulation of looking at where certain sort of presenting needs, certain support needs overlap has been really powerful. So within here, we can look at Domestic abuse, for example, it's affecting 21% of the families that we supported. But as you read across, you can see the knock-on effect that it has. 60% of those families, the kids have got problems at school, very broad sense, but issues with school. 83% of them are assessed with mental or physical health issues within those households. We've taken this back to our partnerships and our sort of beyond the council, and we've had those conversations to say actually something that looks like a police issue actually isn't, because it's an issue for health, it's an issue for education, it's an issue for everybody. Actually, how do we come together and do that in a more effective and joined up way to tackle the problem and offer a better solution to our residents, rather than just trying to balance the pot and balance our budgets and say it costs too much here, it costs too much there, and actually think very differently about it. Again, not hugely complex to do the analysis. The bit that was complex was around bringing together the data to be able to sort of do this in the first place. Let's keep an eye on time. So the next one, and apologies, Stu, I meant to cover this up at the bottom in terms of the source. But we did some fairly rapid work when cost of living first hit, to try and think about the areas, again, that might be most vulnerable to cost of living pressures. And we did use the Experian data that we had at the time to do this. But what I took from this was something that was very simple in terms of trying to look at disposable income patterns within communities, and then looking at the cost pressures that we expected different places to face. So if you were in social rented, you had a level of protection, but you were probably in the lowest income areas. If you're in private rented, you've got no protection and probably in the lowest income areas. If you've got more income and you're able to work through this, then actually how do we think differently? And this helped us sort of try to think about the different areas that we might prioritise and how we might target our resources. Really, really simple piece of work in terms of just putting disposable income on a map alongside areas of sort of rapid increase in prices and costs and accessibility. Our multi-agency group leapt on this straight away. They were lost in the first session of how the hell do we deal with cost of living? We can't. And then immediately when they saw this, they said, actually, we can do something really targeted in these 3 locations, and actually let's just get on with it. And, the investment of funds that were made available actually was really targeted and really made a difference in those areas. Again, there's always a bit of have and have not. It's not perfect. Not everyone in these areas is exactly the same, but it gave us a way of sort of targeting our response based on data, based on intelligence. And then we're now into the sort of looking forward and trying to sort of use modelling and risk stratification to try and think about what our data tells us about the future. So what can we learn from the past to apply to sort of future predictions? I just saw a little bit of the Rachel Reeves thing this morning saying that isn't a thing. Don't look at the past, just look at the future. But we've done that. We've looked at the past and thinking about the future. But this was going back again to adult social care. We know that we've got a fairly crippling budget situation around the cost of support for people who need home care, nursing care, residential care. And how do we think about where those lines might go in the future? And this was some modelling that we did with the University of Manchester. We worked with them jointly on a sort of nationally funded research programme that they were involved in to try and use the council's data that we held on people who were in adult social care system to try and understand some of the drivers that might mean that somebody is more or less likely to need council-funded, council-led residential or nursing support. This was never going to be deployed as an algorithm for decision making. We've been really clear on that as a council. That's not where we want to be. But it helps us sort of do that planning to say we think that demand might be 5% higher next year. It might be 10% higher the year after. But this gives us the ability to think about how we manage that and how we work that through. And then the final example, just to try and give a flavour, is this is sort of bringing together that quantity and qualitative dimension. We do a lot of evaluation type work, so it's more in that research space. This is where we take lots of data across the top around performance of a service, and this is our Family Hub service in children's. Take lots of data, map and plan and understand their performance from that. But we also have lots of user stories. We go out and speak to families, we go out and speak to practitioners, we understand actually what sits behind the data. And when you're doing this type of stuff, that's really, really important. What I would say in the context of today is that's quite people heavy. So I send researchers out, I put people on this to go and have those conversations, facilitate those groups, do those things. AI technology might help us to do some of that stuff more efficiently and effectively, but I still think we need a person in the room to be able to pull out some of that meaningful insight. So they're the examples. Just in terms of some of the stuff then that we've put in place to help us do this and continue to do it is we've got a data strategy. I'm guessing most people in here have or are developing one. We were a little bit late to the party in terms of sort of formally adopting a data strategy. I was asked sort of 3 or 4 years ago to write a data strategy for the council. I did some engagement, spoke to some people. I realised actually people just like the words data strategy. They didn't really understand what it meant or its implications. So we shifted away and did a lot of the things that I said at the start in terms of making sure that our senior leaders were prepared and ready to embrace a data strategy when we came. But we have now got one. It's been adopted internally by our officer leads, our corporate management team. It still needs to go through political approval because it's a formal strategy. So it's in that space at the moment, but we're working on the basis that it's there and we're working to it. No surprises in there. The sort of statement is we want to be a data-driven organisation. We want to use it to improve decision making, to be efficient, be effective, actually offer the best services that we can to our residents. And we've identified 5 main areas that we need to do packages of work off the back of the data strategy to make that happen. One, around data quality. I won't ask for a show of hands of who's got data quality issues because I suspect it's most of us. Improved data access, so a bit of that is around tools, a bit of it's through training, a bit of it's through sort of different ways of working and processes. Strengthening our data governance. I was just talking to colleagues earlier, just before we started, just on in Manchester, our data ownership is a little bit sporadic. When things are going well, it's owned by services and system owners. When it's not going well, it's owned by me and it's my problem. And we've got to do some work around that to make sure that we're clear on who does what, who owns what, where the governance sits around it. So that's a big area for us. Leveraging advanced analytics, part of the purpose of talking to rooms like this and the connections that we've got with other actors, other agencies, is how do we provide the tools and the ways of working to our staff to be able to do this stuff well? How do we do that advanced analytics and not just throw people at it like those 10, 12 examples I've just been through? You know, Paul throws a researcher at it, we can get this done. Actually, how do we replace some of those things with technology and sort of ways of working that means it can be more efficient? And finally, sort of foster that data-driven culture within the organisation. And just on that final point, we've started to look at sort of data maturity. Some of you may be familiar, the Local Government Association's got a data maturity assessment. We've used that within the council. Again, we've used it with those top 200-ish leaders of the council and talked to them around, let's be honest about maturity. You tell us where you think you are as a service and as an individual. And this is the sort of definition that they come up with around data maturity within there. But it involves a few things. There's lots of sort of questions around sort of infrastructure, compliance, storage, data protection within that assessment, but it helps you work through that step by step and ask various questions as we work through. And we wanted to use it as a starting point for discussion around, let's be open, let's be honest. If you don't think you're great at this, just say. It's not a judgment, but actually we need to understand where we are as an organisation. And a bit of a side point, we also included something on inclusive data. Again, I'm sure we've all got similar policies and strategies within our organisations, but in Manchester, we've got our Making Manchester Fairer strategy, which is about addressing inequalities. So it didn't seem appropriate not to include inclusive data within that definition of data maturity. So we've added some additional bits in there that I can share information on if anyone's interested. But what that told us, and really high-tech session with our 200 or so leaders, sticky dots. My daughter loved cutting them out into strips one evening when I realised that I needed like 5,000 sticky dots for 200 people. But we took them along. We had some discussion. We used some of the examples around the types of things that I've shown you today to say, actually, this is what we think good, impactful data and analytics looks like, and good data maturity. Thinking about those things, where do you score yourself against that LGA assessment and put them through? What we found, whilst this looks fairly random and scattered across the board, there's lots of sort of extremes in terms of the responses, but what we found was that there was a really high degree of response that said, we know this is important and we are committed to being data and evidence led, which was amazing, because actually if you haven't got that, then you've got a real problem. The culture sort of issue is a big barrier. But they also told us, but we've got some challenges. We don't get the data we need when we need it in the format or the quality that we need it. We haven't got the skills to be able to do these things confidently. You tell me about this stuff, but I don't really understand it, all of those things. But these are all things that through the data strategy we can respond to and we brought together. Just a few examples in here around the types of things that we're doing beneath each of those 5 objectives. We're doing some audits. We're looking at sort of ways of sort of storing data centrally, thinking about data analytics platforms, those type of things, looking at governance frameworks, looking at data literacy, training and skills, and working with our organisational development colleagues to do things differently. And then this feels like I've just chucked this in at the end, Stu, so apologies, because I know you wanted me to cover LARIA as well. But when I was thinking through this, actually what we're trying to do with LARIA is we're trying to think about our sort of USP in a sense. Actually, how can a national network like LARIA help to have some of the conversations that I've just talked about we're having in Manchester? Manchester hasn't got all the answers. I love talking positively about the work that we do, but we've also got some massive challenges as well. And how do we find the spaces to come together and have those conversations? These type of things are great, but also how do we use LARIA to coordinate some of those things and bring them together? What we've talked about there is that there's sort of 3 main things that we want to achieve. One is, how do we make it easier for local government researchers and analysts to do their job well? So that's a bit about training, that's a bit about support, that's a bit about connections and networks. How do we make it easier for managers and leaders to do this stuff well and effectively, and not feel like they're sat there alone? As I say, I will talk very confidently about what we've done, but there are many days when I sit there thinking I have got no clue on where to start with this, and actually I need to reach out to peers and networks to be able to work that through. And the final bit is sort of a recognition of the sort of important part that private sector organisations have in supporting all of that. We talked about procurement earlier. And not seeing that as we don't really want to pay somebody else to do work that we could invest within the council, but actually looking at it realistically and saying, where are the areas where buying something off the shelf to actually deliver a solution to a particular problem will protect the time and capacity to do some of that stuff, like getting Paul's researchers in the room with family hubs to have a conversation with people as they go. And that's me.